So after you've had your exam, now we want to find out exactly what has happened, how you misaligned. So that's why we take x-rays. Now, when we take an x-ray, we look to see the usual things. Is there something broken? Is there something that's growing in there that shouldn't be there? We look for all the normal stuff, but chiropractors, we look for misalignments. When the joint misaligns in your spine, it can put pressure on a nerve, and then that nerve pressure is going to be a big part of what's causing your discomfort and your pain. The longer you've had the problem, the more degeneration happens. So we want to see how you're misaligned. And based on how you're misaligned, we pull up your x-rays at every visit. Because based on how you're misaligned, that's how we're going to actually correct your problem. So we look to see, are all the bones in the right position? Is your spine straight? Are they rotated? What does the space look like between those bones? There's discs, little cushions, little pillows between each bone. They're called intervertebral discs. So based on that, we look at your x-ray and we measure everything. We're very detailed. You can see all the lines. We measure all sorts of images, exactly how to fix the problem. So between the low back, the neck, there's a lot of different things that come to play together. But as far as your low back pain goes, we don't like to guess. I don't want anybody guessing on my spine. I don't want to guess on your spine, and we won't. We're very particular. So based on how you misalign, like I said, the x-rays are going to help us show us where that is happening. Then what do we do with that information? That enables us to adjust you in the right direction. Chiropractic, it's an amazing profession. And when you do it right, the results are spectacular. So if a joint has misaligned, for the example, this person here, let's look at their pelvis. This ASIN and PIEX means that their pelvis has misaligned in a particular direction. It has shifted like that. So now we know exactly how to fix it. Again, no guesswork. Their spine should be straight. It's not. There's a lot of rotation, and it's sort of like twisting, torquing as it's coming up. So that torquing is not good for you, and it creates a lot of muscle tension, scar tissue, and it's all painless for many, many years possibly, until it isn't painless anymore. And then when it finally starts to hurt you, you go, oh my gosh, my problem just started. But we can see, based on how much degeneration is there, it's actually been there for quite a long time. But those x-rays enable us to very specifically know exactly how we're going to adjust your low back. And the technique that we use the majority of the time is called Gonstead. There's other methods that we use. We use a drop table. We can use instrumentation for people who are a little bit more sensitive, or if they have kind of brittle spines. There's a lot of stuff. Again, we don't guess. So we're going to know if you have something special inside of your spine that needs a particular method of treatment. So again, you're in the right place, Arizona Chiropractic Center. Let's fix your back pain.